Our next three items we're going to take separately but talk about them together. These are to the targeted case management for high utilizers of acute care services, utilizing grant funds allocated for the multi-agency collaborative care. We have three agencies to enter into contracts with: Shift Counseling, Foundation for Life, and Amos Counseling. And we have Lisa Mills, Mesa County Behavioral Health Manager, and Captain Todd Sorensen with the Sheriff's Office to present. So they're going to talk a little bit about the MAC programs, and then we'll vote individually on these three contracts. Good morning, Lisa.
Good morning, Commissioners. Lisa Mills, Mesa County Behavioral Health Manager. So we're here today to talk about and approving three contracts for the multi-agency collaboration of the MAC team. So MAC started last year, September of 2022, and has received over 320 referrals since that time. It supports case management services in the community for our most vulnerable populations. Referrals come in from all three hospitals, detentions facilities, law enforcement, co-response teams, and our fire and EMS. This program has been very successful in the fact that it's gone beyond what we expected, anticipating in the beginning how we would be helpful and supportive. And we are still working on the data. It'll take us 3 years to get the solid data to show that we are hitting the markers that we had anticipated when we started. But we've shown anecdotal success, and many things have been supportive of first responders. So today, Captain Sorensen's here to help talk about the work that we've done with co-response and with first responders and some of the successes there.
Great, thank you. Good morning, Captain Sorensen.
Good morning, Captain Todd Sorensen with the Sheriff's Office. Yeah, this has been a very rapid cascade of successes. And I'm just going to capture two of them right here, just I think are very illustrative of what we're being able to do. And I'm telling you, the Sheriff's Office and Behavioral Health are really gelling at a level and faster than I would have anticipated. And it's reaching deeper into the patrol division. Like these guys they accept change quick once they understand the vision, and we cast a vision for them, and they accepted it, and they just took off running. And there's just I'm just going to capture two of them here, but it's very illustrative of what we do with this, how bringing everything together, including our real-time crime center, which we came here a couple years ago and we're talking about that. And we brought that to bear into this. It's really brought a lot of things to bear into this fight. So anyways, two quick ones that I got is we had patrol got dispatched by our 911 dispatch center to a suspicious incident, probably like an auto theft in progress. Somebody was out there kind of manically trying to break into a car, like trying to ajar the doors, not breaking it that way, but just trying to get the doors open. No shirt, no shoes, weren't dressed for the environment. It's cold outside, so they weren't dressed for the elements. So a couple of things that caught our real-time crime sergeant, just because maybe I should be paying attention to this. Patrol gets on scene, they're able to identify that guy. When they identified the person, the real-time crime supervisor quickly ran it into our internal records, which we've worked together to put these MAC, to identify the MAC population. So we know those are our high-frequency utilizers, trying to manage this population better so they're not hitting our resources unnecessarily. So he tells patrol, or just airs it, hey, just be advised this is a MAC client. So our co-responder, who would have never otherwise gone to this call, they've got enough to do. You know, these guys handle the auto theft. They're doing all these mental health crisis stuff. It's like, okay, we're going to go up there because it's a MAC client. So by the time they get there, they help de-escalate this stuff. It was just a person that was in mental health crisis and not dressed for the weather and having a manic incident. Our clinician does a needs assessment, reports it. We already know who they belong to for MAC. It was Amos Counseling. Tell them, hey, we have your guy out here, get a response, gives a needs assessment. They come there with provisions. And in minutes, this thing was de-escalated. No impact on St. Mary's ER, no impact on West Springs Hospital, no impact on our jail. Gave them what they needed and took them back to Amos Counseling, and this thing was done in minutes. So that was huge.
That's great.
I had another one the other day where a citizen calls in and sees a suspicious incident, probably a mental health crisis. Somebody was out again around a car. It was an incident around a car again. Patrol goes out there, not knowing what it is. They identify the person. It's a MAC client. Person was just locked out of their vehicle, having a manic incident as a result of that. But patrol, they're starting to short circuit it. So patrol within itself, they look, hey, it's a MAC client, tell their buddy that's going to the call. They get a hold of the MAC provider and also get a hold of a locksmith, come out, open the car. This whole thing was done in minutes. Again, none of this stuff. So all I'm saying is we can do this over and over and over again. And we can't just do it with law enforcement. I mean, we can, but we can also include fire and EMS. And those are the guys that are starting to get excited about this too, to avoid these unnecessary transports. to somebody that, yeah, we can't leave them here, but we don't have anything else to do with them, so we've got to take them to the ER, which is the most expensive place we could take somebody. If we have case management in place, it allows us to avert all of that at a huge cost savings. So anyways.
Thank you, Captain Sorensen. It's exciting to see what we had hoped for finally play out. We're going to see more of it too. Do either of you have any questions?
Said a comment. It's nice to see us investing in something more than cement walls and iron bars. This seems to be an investment that's paying off, not just financially, but in terms of people's lives improved. And thank you guys. We're so appreciative for what you guys are doing.
Absolutely. I just would like to point out the funding on this really quickly. Funding percent has been 100% grant funded. These current contracts that we're talking about today are funded through two areas: State Division of Criminal Justice Multidisciplinary Crime Prevention Grant, along with our stated BHA grant, which we were awarded earlier this year. These contracts will expand MAC capacity from currently at 150 to expand it to 300 active clients, which doubles our capacity, which is really exciting for all the teams involved. We're also extending, we had 3 agencies last year that were working part of MAC. We're expanding and adding an additional brand new agency to this team. So that'll give us 4, which will expand not only capacity, but breadth of knowledge and ability to really support people in a different way. So we're really excited about that. I just want to say one more thing. Without their dedication, the hard work of these agencies, their love and compassion for the people that they serve, and their dedication to our county, we couldn't have done this. So I'm excited about that.
I think Commissioner Daniel, you had a comment?
This is definitely common sense in action that really values humanity in a profound way with outcomes that we really can all be proud of in our community. And thank you for what you're doing. We appreciate you.
Yes, you guys have shown great leadership, and the MAC teams, as you said, have just been, the humanity they show to these, some of the most vulnerable in our community, giving them really a second chance. So thank you for what you do. Let's take the first contract then with Shift Counseling, which is for amount not to exceed $300,000. Did you have any comments about that contract?
No, except we're excited. They're the new agency that's coming aboard. Their contract is a little bit more so they can get up and going in an expansion of services, but we're excited to have them aboard.
Okay. Does anyone in the audience have any comments or questions on item 3, the contract with Shift Counseling? Seeing none, I'll entertain a motion to consider approving the contract with Shift Counseling to provide the targeted case management to high utilizers of acute care services utilizing grant funds allocated for the multi-agency collaborative care not to exceed $300,000.
So moved.
All in favor?
Aye.
Aye. Motion carries 3-0. Item number 4 is the same. This is a contract with Foundations for Life to provide the targeted case management to high utilizers of acute care services utilizing grant funds allocated for multi-agency collaborative care and not to exceed $275,000. Is there any comment from the public on this item? Either of you have any comments? I'll entertain a motion to approve item 4 as entered into the record.
Second.
All in favor?
Aye.
Aye. Motion carries 3-0. And the last contract is with Amos Counseling, again, to provide the targeted case management to high utilizers of acute care services, utilizing grant funds allocated for multi-agency collaborative care and not to exceed $275,000. Does anyone in the audience have any comments on this item? Seeing none, I'll entertain a motion.
So moved.
All in favor?
Aye.
Aye. Motion carries 3-0. Thank you both.